Welcome to Catalyst Made Web, where we ignite understanding and make learning easier. In our today's class, we'll be discussing about intercostal space. As we all know, there are 12 pairs of ribs, and in between these ribs, there are spaces. And those spaces are what they call intercostal space. The intercostal space are the spaces that are situated between two adjacent ribs. As you can see in this diagram, this is our sternum. This is the thoracic vertebra, and this is our adjacent ribs. In between this rib is where the intercostal space is located. So this space here is our intercostal space, and the intercostal space, they are bounded anteriorly by the costal cartilage of the sternum. This is the costal cartilage. Costal cartilage, they are bounded anteriorly by the costal cartilage. Bounded posteriorly by the thoracic vertebra. And they are bounded superiorly by the lower border of the rib above, and bounded inferiorly by the upper border of the ribs below. Now, there are 11 intercostal spaces that are situated on either side of the chest. The intercostal spaces are classified into two. There are typical intercostal space, and atypical intercostal space. The typical intercostal space are the space in which the blood supply and the nerve are only confined to the thorax, whereby the atypical intercostal space, they are the space in which the blood supply and the nerve supply other regions in addition to the thorax. Typical intercostal space are 3rd to the 6th intercostal space. 3rd to the 6th intercostal space are the typical intercostal space, whereby the 1st, 2nd, and 7th to the 11th intercostal space are atypical intercostal space. Now, the contents of the intercostal space. Intercostal space contains the following. 1. It contains the muscles, veins, arteries, nerves, and lymphatics or lymph vessels. These are the contents of the intercostal space. There are intercostal muscles, intercostal veins, intercostal arteries, intercostal nerves, and the lymph vessels. The intercostal muscles, we've already discussed more on the intercostal muscles in our previous video, where we talk about the thoracic wall. The intercostal muscles are arranged in 3 layers: the external intercostal muscle, the internal intercostal muscle, and the innermost intercostal muscle. The major functions of the intercostal muscle is that they hold the ribs together to prevent their separation, as well as help to elevate the rib during respiration. External intercostal muscle help to elevate the ribs during inhalation, whereby the internal intercostal and the innermost intercostal muscle help to elevate the rib during expiration. From this diagram, this is our innermost intercostal muscle. This inner intercostal muscle. And this external intercostal muscle. This is our rib, and there are also intercostal veins, intercostal artery, intercostal nerves. These are intercostal vein. In between the intercostal vein and the intercostal nerve, there are intercostal arteries. So this diagram here is showing us the contents of the intercostal space. The intercostal muscles, further divided into 3 layers or arranged in 3 layers: the external intercostal muscle, the internal intercostal muscle, and the innermost intercostal muscle. Now, the arrangement of the neurovascular bundle in our intercostal space is that from above downward, there is intercostal vein, intercostal artery, and the intercostal nerve. Now, the intercostal nerves. The thoracic spinal nerve, they are the one that supplies the intercostal spaces. There are 12 thoracic spinal nerves, and immediately they reach the intervertebral foramina, they divided into the anterior and the posterior ramen. The anterior ramen of the upper 11 thoracic spinal nerve, they are the one that are called intercostal nerve. Upper T1 to T11, they are the one that they call intercostal nerve because they causes in intercostal spaces, whereby the anterior ramen of the T12 enter the abdominal wall and below the 12th rib, and it is called subcostal nerve. T12 is called subcostal nerve because it does not causes in the intercostal spaces. So therefore, the anterior ramen of the upper 11 thoracic spinal nerve forms the intercostal nerves. And the intercostal nerves are further classified into 2. There are typical intercostal nerve and atypical intercostal nerve. The typical intercostal nerve, they are the nerves that supply only the thoracic wall, whereby the atypical intercostal nerve, they are the nerve that supply other regions in addition to the intercostal spaces or intercostal space. Typical intercostal nerve, they are the intercostal nerve that are present in the typical intercostal spaces. And we've already said that our typical intercostal spaces are from the 3rd to the 6th intercostal spaces. So the typical intercostal nerve are T3 to T6. They are the anterior ramen of T3 to T6. They are the typical intercostal nerves. Now, the cause and relation of typical intercostal nerve. Cause and relation of typical intercostal nerve. Immediately after their origin, they run laterally behind the sympathetic trunk and enter intercostal space between parietal pleura and posterior intercostal membrane, and they enter the costal groove where they make a relation with other vessels like the artery and the vein. And the relation is that intercostal nerve is located between the intercostal artery and the intercostal vein. So they form the neurovascular bundle, which is located between the inner intercostal muscle and the innermost intercostal muscles. Now, at the sternal end of the intercostal space, the intercostal nerve pierces innermost intercostal muscle, anterior intercostal membrane, and pectoralis major, where they terminate as anterior cutaneous nerve. So the intercostal nerve terminates anteriorly as anterior cutaneous nerve. Branches of typical intercostal nerves. Typical intercostal nerve gives off 5 different branches. There are rami commutans, muscular branch, collateral branch, anterior cutaneous branch, and lateral cutaneous branch. We said the branches are rami commutans. Rami commutans, there is muscular branch, collateral branch, lateral cutaneous branch, and anterior cutaneous branch. So these are the branches of typical intercostal nerves. There are rami communicants. These rami communicants, they are of two types. There is white rami communicants and green rami communicants, and they serve as a means of communication between each spinal nerve with the vertebral ganglion. The muscular branch, they are the small branch which give or supply the muscles, such as the intercostal muscles. The collateral branch arises from the posterior aspect of the intercostal space near the angle of the ribs, and it supplies the intercostal space. It supplies the intercostal muscle as well. Lateral cutaneous branch. The lateral cutaneous branch as well arises from the posterior aspect of the intercostal space near the angle of the ribs. At the mid-axillary line, this lateral cutaneous branch divided into two branches, which are the anterior and the posterior branch, and they supply the lateral wall of the thorax. The anterior cutaneous branch is the terminal branch of typical intercostal nerves, and it supplies the anterior aspect of the thorax. It is divided into the two. There is lateral and the medial branch of the anterior cutaneous nerve. So this diagram here is showing us the intercostal nerve together with some of its branches. The red marker here is our intercostal nerve. Is our intercostal nerve. This is our ganglion, sympathetic ganglion. This branch here is the rami communicant. Here, this is our lateral cutaneous branch. And we say that the lateral cutaneous branch is divided into two at the mid-axillary line. It's divided into the anterior branch. This is the anterior branch of lateral cutaneous, and this is the posterior branch of lateral cutaneous. This branch here is our anterior cutaneous branch. Anterior cutaneous branch. We also say that the anterior cutaneous branch is divided into two branches as well, the medial and the lateral. This is our medial branch of anterior cutaneous branch, and this is the lateral branch of anterior cutaneous branch. So this diagram here is showing us the cause, the relation, as well as the branches of the intercostal nerve. The atypical intercostal nerve, they are the T1, T2, T7, T8, T9, T10, and T11. All the anterior rami of the T1, T2, T7 to T11, they are the atypical intercostal nerve because they supply other regions in addition to the thoracic wall. T1, anterior rami of the first thoracic nerve. It joins the anterior rami of the cervical nerve to form the brachial plexus, the lower trunk of the brachial plexus, which supplies the upper limb. T2, the lateral cutaneous branch of the T2, that is spinal thoracic vertebra, is called intercostobrachial nerve. Intercostobrachial nerve. This intercostobrachial nerve is the one that supplies the skin of the floor of the axilla together with the medial side of the upper arm. Again, during coronary artery disease, the pain are referred into the medial side of the arm by this intercostobrachial nerve. Anterior rami of T7 to T8, after supplying their corresponding space in the thorax, they enter the abdomen, where they supply the anterior abdominal wall muscles as well as the skin of the anterior of the abdominal wall. So they are all together called thoraco-abdominal nerves. Now there is one unique feature of intercostal nerves. Intercostal nerves, they are segmental in nature. They do not form nerve plexus, unlike the cervical that form the brachial plexus or the lumbar that forms the lumbar plexus. They are segmental in nature. Now, the clinical correlation of intercostal nerves is that there is intercostal nerve blockage in order to provide local anesthesia in one or more of the intercostal space. Also, thoracotomy usually performed along the cyst ribs, and also there is what they call the root pain or the girdle pain, which occur due to the irritation of the intercostal nerves. Intercostal arteries, as we all know, is one of the contents of the intercostal space. The intercostal space or the thoracic wall, they are richly supplied by two major types of intercostal artery. There is anterior intercostal artery and the posterior intercostal artery. In each of the intercostal space, there are two anterior intercostal artery and one posterior intercostal artery. And the posterior intercostal artery supply most of the larger part of the intercostal space. We said intercostal space are supplied by two major types of intercostal arteries: the anterior intercostal artery and the posterior intercostal artery. In each of the intercostal space, there are two anterior intercostal artery and one posterior intercostal artery. Now, to the posterior intercostal artery, the posterior intercostal artery supplies the greater extent of the intercostal space. There are 11 posterior intercostal arteries in each side. Now, the origin of the posterior intercostal artery is that the first and the second posterior intercostal artery arises from the superior intercostal artery, that is a branch of costocervical trunk. The first and second posterior intercostal artery, they are branch of superior intercostal artery. And this superior intercostal artery is a branch of costocervical trunk. Whereby the third to the 11th posterior intercostal artery, they are branches from the descending thoracic aorta. Now, the relations of the posterior intercostal artery. In the intercostal space, intercostal arteries, they are located between the intercostal vein and the intercostal nerves. Terminations of the posterior intercostal artery. In the intercostal space, the posterior intercostal artery terminated at the junction of costochondria, where it anastomosizes with the anterior intercostal artery of the same space. Also, there is right posterior intercostal artery and the left posterior intercostal artery. The right posterior intercostal artery is usually longer than the left posterior intercostal artery because the arc of the aorta is situated at the left side of the sternum. Branches of posterior intercostal artery. Posterior intercostal artery gives off 6 branches. There are dorsal branch, collateral branch, muscular branch, lateral cutaneous branch, mammary branch, as well as the right bronchial branch. The dorsal branch of the posterior intercostal artery is the one that supplies the back, the spinal cord, as well as the vertebra. The muscular branch supplies the muscles of the intercostal space. The collateral branch is the one that forms anastomosis with the lower part of anterior intercostal artery. The lateral cutaneous branch follows or accompanies the lateral cutaneous nerve. The mammary gland arises from second to the 4th posterior intercostal artery and it supplies the mammary gland, whereas the right bronchial branch arises from the 3rd posterior intercostal artery. Now, the anterior intercostal artery. We say that there are 2 anterior intercostal arteries that are situated in each of the space. There is upper anterior intercostal artery and the lower anterior intercostal artery that are present in each of the space. Also, we should know that we have only 9 anterior intercostal arteries. That is, it is only upper 9 intercostal space that owns anterior intercostal artery, because the 10th and the 11th intercostal space do not extend forward to have anterior intercostal artery. Origin of the anterior intercostal artery. Upper 6th anterior intercostal artery, that is the 1st to the 6th anterior intercostal artery, they are branches from internal thoracic artery. They are branches from internal thoracic artery, whereby the 7th to the 9th anterior intercostal artery, they are branches from musculophrenic artery. The first 6th anterior intercostal artery, they are branches from the internal thoracic artery, whereby the 7th to the 9th intercostal artery are branches from musculophrenic artery. Termination of anterior intercostal artery. The upper anterior intercostal artery terminates at the junction of costochondria by anastomosized with the posterior intercostal artery, whereby the lower anterior intercostal artery anastomosized with the collateral branch of posterior intercostal artery of the same space. Now, the intercostal vein is also one of the content of intercostal space. The intercostal veins, they follow the intercostal arteries as well. So in each space, there are anterior intercostal vein and there is posterior intercostal vein. In each of the space, there are 2 anterior intercostal vein and 1 posterior intercostal vein. The anterior intercostal vein, they follow the anterior intercostal artery and they terminate by the upper 6th. First to the 6th anterior intercostal vein terminates by ending in the internal thoracic vein, whereby the 7th to the 9th they terminate by end in musculophrenic vein. For the posterior intercostal vein, the posterior intercostal vein are present in all the 11th intercostal space. They follow posterior intercostal arteries, and the mode of the termination of the posterior intercostal vein differs on the right and the left side of the body. Now, this on the right side and this the left side. The first posterior intercostal vein, that is the largest posterior intercostal vein, terminates in right brachiocephalic vein, whereby the first posterior intercostal vein at the left side terminates in left brachiocephalic vein. Second to the 4th right posterior intercostal artery joins together to form right superior intercostal vein and they terminate at the azygos vein, whereby the 2nd to the 4th left posterior intercostal vein join together to form left superior intercostal vein and they terminate in left brachiocephalic vein. 5th to 11th right posterior intercostal vein terminates in azygos vein, whereby 5th to the 8th left posterior intercostal vein terminates in accessory azygos vein. Accessory azygos vein, whereas the 9th to the 11th posterior intercostal vein terminates in hemizygos vein. So this is the mode of termination of the posterior intercostal vein. It differs in the right and the left side of the body. For the intercostal lymph node, the lymph node from the anterior aspect of the intercostal space, they are drained into the internal anterior lymph node, whereby the lymph vessels from the posterior aspect of intercostal space, they are drained into the posterior lymph node. This comes to the end of our intercostal space. Kindly subscribe, like, comment, share, and don't forget to turn on the notification bell so that when I release new video, you'll get notified.